check. So everyone, I think we will start the meeting in 10, maybe around 5 or 10 minutes. Check, check. For those participants who haven't tested the antigen, we provided at right at the corner of this room. Okay, everyone, I think we will start this agenda. Good morning, good afternoon, and good evening, ladies and gentlemen, to all participants and members of Civil-20 Vaccine Access and Global Health Working Group, those who joining us online and also here in this room. Before we proceed to this meeting, let me introduce myself. My name is Audi. I'm from Indonesia for Global Justice, and I'll be the master ceremony for this event. So welcome to C20 Vaccine Access and Global Health Meeting, ensuring access to health and COVID-19 tools through G20 and inequality and build stronger mechanisms. So this meeting aims to consolidate and finalize C20 Vaccine Access and Global Health Working Group response and recommendation for third G20 Health Working Group meeting. So this meeting will be conducted 2 days. For today, we will have the opening sessions, and after that, the first plenary sessions to discuss vaccines equality in Global South and COVID-19 access for vulnerable groups. For the second plenary sessions, we will have discussions about challenging in access of Civil-20 tools and how the G20 address these problems. So for tomorrow, we will have the side event and third plenary sessions about financings on COVID-19 and pandemic prevention, preparedness, and response. So we kindly remind you that the organizer will provide interpreter on the Zoom platform for translation in English to Bahasa and Bahasa to English. If you are online participant, please use the interpreter tools. If you are here in this room, please join the Zoom through your own device and use the interpreter tools. Without further ado, we will start this meeting by hearing Indonesian national anthem first, Indonesia Raya. So ladies and gentlemen, please stand up. Ladies and gentlemen, be seated. Next, we will hear the welcoming remarks from Bapak Maulana Siddiq as the Executive Director of Indonesia for Global Justice. Please, Bapak Maulana, the floor to the stand. The floor is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat sore, salam sejahtera bagi kita semua. Mohon maaf, saya menggunakan bahasa Indonesia dalam pembukaan kalimat pembukaan ini. Ya, kami Indonesia for Global Justice dan saya selaku Direktur Eksekutif Indonesia for Global Justice mengucapkan pertama terima kasih yang sebesar-besarnya kepada seluruh pihak yang bersama-sama mensukseskan dan secara konsisten dalam mensukseskan agenda bersama ini dengan agenda kita hari ini untuk mendiskusikan persoalan memastikan akses alat kesehatan dan COVID-19 melalui G20, akhiri ketimpangan, bangun mekanisme yang lebih kuat. Dan yang terpenting adalah kami Indonesia for Global Justice, IGJ, berterima kasih kepada yang turut hadir dalam pertemuan ini. Ada Sherpa C20, ada Mas Maftuh. Terima kasih Mas Maftuh sudah hadir. Kemudian ada juga koordinator Working Group Vakses Action Global Health, ada Agung Prakoso di sini, kemudian ada Rachel Ong juga hadir dalam kesempatan ini, dan ada Bang Daniel juga hadir. Terima kasih sudah hadir dalam kegiatan dan diskusi ini. Ini sangat penting bagi kami untuk memastikan bagaimana akses kesehatan publik bisa dijangkau dan tidak ada ketimpangan di Indonesia maupun di tingkat dunia. Ya, tentunya pertemuan ini menjadi sangat penting untuk menjadi momentum bagi kita bersama dalam mendorong isu kesehatan publik dan juga akses kesehatan di tengah pandemi COVID-19. Dan tentunya juga tugas dan perjuangan kita masih terus berlanjut agar isu ketimpangan maupun akses kesehatan publik yang bisa dijangkau oleh setiap orang bisa diraih. Karenanya menjadi harapan kita bersama bahwa pertemuan maupun kegiatan ini bisa menjadi momentum untuk memperkuat isu akses kesehatan yang layak agar ketimpangan terhadap kesehatan publik bisa diakhiri. Dan terakhir, kami Indonesia for Global Justice terus konsisten dan berjuang dan juga mendukung agar isu akses kesehatan maupun menghilangkan ketimpangan terhadap akses kesehatan di tengah pandemi COVID-19 ini bisa dijadikan salah satu isu penting yang dimasukkan dalam G20 Declaration dan kemudian maupun di dalam Health Working Group G20. Terakhir, semoga kita semua diberi kesehatan dan juga semangat untuk terus konsisten menyuarakan isu-isu publik secara luas. Demikian yang dapat saya sampaikan. Terima kasih atas kesempatan dan juga waktunya. Salam sejahtera bagi kita semua. Assalamualaikum warahmatullahi wabarakatuh.
Next, we will hear Bapak Agung Prakoso as one of the Civil-20 Vaccine Access and Global Health Working Group. Please, Bapak, the floor is yours.
Thank you, Master of Ceremony. Good morning, good afternoon, good evening, all members of the Civil-20 Vaccine Access and Global Health Working Groups in person in the Jakarta and also in Zoom platform. I will introduce myself, but before I introduce myself, I will introduce first because I'm not alone in here as the coordinators. First, we have Rachel Ong from Global Fund Advocates Network Asia Pacific, and also we have Daniel Marguari as the CEO of Spiritia Foundation. Thank you for all coordinators for your hard work until now on the Civil-20 Vaccine Access Global Health Working Groups. And also we have one more, Angela Taneja from Oxfam India, who joined online in this platform. And also many thankful for all members of the Civil-20 Vaccine Access and Global Health Working Groups. Now we have some colleagues from international members. We have Lance Espacio from People Vaccine Alliance. Nice to meet you. We have Mr. Deepak Dungal from AIDS Healthcare Foundation. We have also Ananya Basu from Public Services International. All these international members, thank you very much for coming to Indonesia. Please enjoy, and please we will have a great discussion because you are here is in, and we hope that it will be helpful for our works in the Civil-20. And I want to say hi also to Mas Ahmad Tuhan as the Sherpa of Civil-20. You know that Sherpa is to bring us to reach our goals in the Civil-20. So Mas Maftu already hard work to this Civil-20. So I want to thankful also to Mas Maftu. And now distinguished speakers to this opening session and also to all plenary session, I want to say hi to Professor Petros, Managing Director of Afrigan. We will learn a lot from her about how to manufacturing the vaccine, what's the problem, and how we can take the lesson learned to Indonesia as the presidency of the G20. Also to civil society, how we can push the G20 to expand the access to COVID-19 tools and all health commodities. Okay. This meeting take theme ensuring access to health and COVID-19 tools through G20. And inequalities build the stronger mechanism. The theme of this meeting aim to consolidate and finalize the C20 Vaccine Access and Global Health Working Groups responses and recommendation to the third G20 Health Working Group meeting. As we know that in this August also, the 22nd until 24th, the G20 Health Working Groups will be conduct the meeting with the issue to discuss the issue related to expanding manufacture and research hub on vaccine diagnostic and therapeutics. These two kinds of terms look like have the same areas, but as civil society, we should note that the importance of the expanding manufacturing is not easy. We already work for this issue more than 2 decades. Since the WTO was developed, and one of regime of WTO is free trade, is the trade related on intellectual property rights. Since that, we already face the main challenging in access to medicine. For example, to HRV, to TB drugs, to cancer, and etc. Medicine as a basic needs of human monopolized by private sector. Now, when we passing the pandemic, this is happen again. So it's hard for us, and the impact is. And the impact of this regime is this inequality of vaccine. This map show how the inequalities of vaccine more than just how the countries buy the vaccine. It's some of us agreed this called vaccine apartheid. So how we can push the G20 itself as the 20 countries, the strongest countries in the world, to deliver this problem, to end this inequality. The aim of our meeting today is to consolidate. We will hear more with our expert, and we will develop our recommendation. And until now, the Civil-20 Vaccine Access and Global Health Working Groups have the 4 priorities issues. The first is strengthening global. The first is inclusive global health architecture. Why we call it because the global health architecture should have the accountability, should have the transparency mechanism, and should engage with all the civil society into the governing the structure. And this is why we call inclusive global health architecture. As you know, the G20 now built some new financing mechanism called Financial Intermediary Fund, and we also have the notes on this because this we push the G20 itself to make this mechanism more transparent, accountable, and also represented by civil society. So Why we call it inclusive? Because we need to push our representative on the global health architecture. We also put the strengthening public health ecosystem as our key priorities, because the public health ecosystem built of our works. And also expanding access to health and COVID-19 commodities is the most important also in the pandemic of COVID-19 tools. If we want to end this pandemic, we need to expand more the access to health, not only vaccine, but also diagnostic and therapeutics, not only in COVID, in all diseases, in all medicines of all diseases. This is what we want to address in the G20. And also on the universal health coverage, we need to achieve in the universal health coverage. Universal health coverage is basic needs of us. And all of this is not easy. G20 moves so fast, discuss so fast. We are trying the best to tell them how to reach the public health, how to expand the COVID-19 access, how to make the health system more stronger. And the most important in G20 process is we need to tell them. Until now, we don't have any chance, we don't have any opportunity to giving intervention on the process. So we are now conduct the meeting, our meeting, and we need to tell them that nothing about us without us. If you want to discuss, or if you want to build mechanism or all anything related to peoples, related to health, health means peoples, health means society, discuss it with peoples, discuss it with society, put the society in governing. And the most important is no profit on that. No profit on people's life, no profit on people's death. So this is what we will discuss, and we hope that Civil-20 will bring up these needs to the G20. Thank you.
Thank you, Bapak Agung, for such a lovely remarks. Next, we'll move to the opening speech from Bapak Maftuhan as Sherpa Civil-20. To the stand, Bapak, if you are ready.
I think too much opening, yeah? Okay. A good evening, good afternoon, good morning to all CSO leaders across the world, colleagues and friends. First of all, thank you so much for your efforts, your attending in this meeting, because it is very meaningful for civil society organization across the world as part of our civil society campaign and advocacy in health issue, especially on access vaccine and global health. As a Sherpa of C20, I'm quite optimistic that we can achieve some in terms of policy recommendation adopted by G20, or we have a common ground on certain issues. At this meeting, I would like to push all of members especially member of Access Vaccine and Health Working Group, to decide at least two important agenda. First is our priority issues. Yeah, Agung already mentioned that access vaccine and global health already decide 4 priority issues. Yeah. I think it's quite good, and if we still on a discussion that need to more concise or to more broad in other sense, it is our momentum to finalizing our priority issues in health working group. The second is we should finalizing our recommendation on 4 priorities issues that already choose by the working group. Why we should decide faster? Because we need to following the process in our counterpart, which is health working group in G20, for making sure that we are shadowing the process of G20 quite strong. In some working group already decide the priority issues and recommendation, but 1 or 2 working group that we have still on discussion, because as we know, the working group in C20 quite huge in terms of topic. For example, in education, digitalization, and civic space, yeah, it's quite broad. They didn't have previous experiences how to work together on certain issues, and then working group of environment, climate issue, and energy transition. Even though any similarity, any common platform, but still we have a challenge how to create interconnected issue and recommendation in our policy pack development. So it is our challenge, but we should optimistic that we can make it with a result that not far from the previous C20 presidency, and the recommendation robust, the recommendation feasible, not only in technical aspect but also in the political aspect. For example, on financial intermediary fund, I got new information fresh from the oven. The idea of multi-stakeholder platform in FIF governance agreed by more than 10 member countries of G20. Yeah. Indonesia agree, US agree, WHO agree, UK agree, but 5 days ago, the China government said to our counterpart that China government committed to give another 50 billion US dollar in FIF, but they have one conditionality. The conditionality is no CSO representative in the governance of FIF. So it is our challenge for today, and we should make some new approach, new effort, how we reach our colleagues in global more stronger. For example, how do we make a collaboration with our colleagues in China to push their government to open the governance of FIF for civil society organization representative. So the situation is very dynamic, and we should use a two approach. The internal aspect, we should more collaborate each other, more support each other, and in the external aspect, we should following all process and got a lot of support and information from many countries, especially non G20 member countries as well. So the other thing that I will suggest to all of us today is about we should develop so-called numeric and ambitious target. For example, on access vaccine for developing and less developed countries. Yes, WHO already agreed 70% in 2022. Mid 2022. For global target, it is quite not ambitious in regard to the current condition in G20 member countries, but in regard to all countries, quite ambitious. But as our tradition, we should bring more ambitious agenda. So we should choose the target of vaccination globally. So we can bring target as our recommendation. And the second, for example, the vaccination target dose one in, for example, 2023 or 2024, XX%, dose 2 in 2024, semester 1, for example, XX%, and so on and so on. So we should try to bring a numeric proposal. And it is important because we'll make a government or leader modality to bring a negotiation among countries, member countries. The second is about tangible. So if we cannot agree by consensus in our working group on numeric target, at least we can make a consensus on tangible target. Yeah, we should try to use that approach, because the government, the G20 leader usually call us what your recommendation that can be translated to the policy conversation in working group of G20 meeting and declaration. So I think that is all from my side, and I hope really high to member of working group access vaccine and global health to discuss more faster and agreed on certain issues, and we will host the workshop on policy pack and communique drafting in the end of August. So we expect that all working group bring policy packs and recommendation a week before workshop of communique drafting and policy pack drafting on 30 and 31 August. So it is our because we need to make sure that we still have time to following all meeting in our counterpart. September, all working group in Sherpa track and some working group in finance track will decide ministerial declaration. So if we have a modality in the beginning of September, it will be more easier for us to strengthen our advocacy, our effort to bring our recommendation that will accommodate in the ministerial declaration, at least in annexes of the declaration, because a lot of document that can be one of our challenge to deliver our recommendation or our proposal. Once again, thank you so much, everyone, and we, as a secretariat, as a leader of C20, hope that we can see you all in Bali for the summit. As you know, we make some change. We will hold the C20 summit on 5 until 7 October 22 in Bali, in person. That was rescheduled because suggestion from the G20 Secretariat and Deputy G20 Finance, because in 12 until 16 October, the finance minister and central bank governors will meeting in food meeting in DC, and then also IMF World Bank annual meeting. It is quite difficult if we expect some counterpart of our working group can attend in our summit. So we move on 5 until 7 October rather than in end of October, because if we choose end of October, it is more difficult for us because quite close with the G20 leader summit. That is all. Once again, thank you. Congratulate for working group of vaccine access and global health for have a meeting today and tomorrow. Hopefully our meeting is fruitful and can achieve concrete recommendation. Thank you so much. Good afternoon.
Thank you, Bapak Maftuf, for the insightful information to all of us. Next, we will hear the keynote speech from Professor Petro Terblanche. As a Managing Director, Afrigen South Africa, we will talk about lesson learned from South Africa on how to build manufacturing hub on VDT in regions. Are you with us? Can you give us a sign if you can hear us or say something? Professor?
I can hear you. Can you hear me now?
Yes. Yes, obviously. Okay, the
Thank
screen
you very
is...
much.
Okay, the screen is yours, Professor.
Thank you and good day to all the participants, and thank you for inviting me into this meeting. Can I share my slides myself, or are you gonna, can you share my slides or enable me to share? Ah, thank you. Can everybody see the first slide?
Yes, clear. Thank you, Professor.
Thank you. I want to share with you how beautiful it was at the start of the session to listen to the Indonesian anthem. Thank you for that. It's I think it's the first time in my life that I actually really could listen to it, and it's very beautiful. I am going to share some learning with you, but before I start, you'll see on this slide is a logo for AfriGen. And I thought I want to share with this distinguished group what this logo means. When AfriGen started up as a company, we wanted to design something that fundamentally tells about our company. And this logo tells it. You'll see Africa, the continent, and it demonstrates our passion for Africa. But what is very profound about this logo is the connectivity and the partnerships and the global. So this company is built on a partnership model. With all the connectivities that link us all. But it was also in this logo, you can see the change in color from day to night, and it demonstrates how the birth of a new company where the globe turns from east to west. So my wish for all your work is that it will bear fruit, that it will be a dawn of a new day for vaccine and essential health technology supply to low and middle income countries, and that it will be a connectivity. Can I have the next slide, please? Thank you. I wanted to remind us all, and we've not that you would have ever forgot that we must always remember the numbers. And this is the starting CDC statistics around what the impact of vaccination was and still is on death. 9 times less death recorded for vaccinated people. So the vaccines that was introduced in a record time into human populations proved to be safe and proved to be effective to prevent death. It is the right of every human being on this globe to have access to this very essential health technology. Next slide, please. So I'm going to share a few slides and to demonstrate the learning, and I will use the mRNA Hub program as the case study to demonstrate that. And the motto and the theme of my presentation is, just because it is difficult, impossible, hard, does not mean it has to be. Next slide, please. First learning. If we have no vision-aligned partners, we have no hope. So the mRNA Technology Transfer and Training Hub program created by the WHO and partners represents global health organizations, public sector, private sector, universities coming together with a common goal and a common vision to develop manufacturing capacity in low and middle income countries. An essential learning for us in terms of the partnerships and unconventional partnerships, because here's public and private sector partnering for a goal which is a public good goal. Next slide, please. No bold leadership, no roadmap. This slide, I wanted to demonstrate the importance of leadership from WHO Director General to country leadership. All of these countries listed that has now become part of the mRNA Hub program. This required leadership at political and country level to join a network and to be part of a network that is the biggest project ever in the history of vaccine manufacturing or the vaccine sector. This again demonstrates the importance of bold leadership. Next slide, please. The key pillars of learning. What I want to demonstrate in this slide is the power of partnerships again. Look at the organizations, global health organizations, combining and partnering, coming together to put a complex but success-orientated project together. The second learning that is very important is that we have to be able to combine innovation, intellectual property knowledge and product development with scale-up, regulatory, business models and financing, funding and governance, and of course, the very important component about building skills and capacity, human capital, human capacity in low and middle income countries to support this program. Multidisciplinary, multi-sector orientated, vertically integrated, and a value system approach. Important learning. Next slide, please. And just because those who mastered it doomed us to failure should not have made us doubt ourselves. I want to show this slide as a tribute to the women's team working on the science program of the mRNA Hub. This month in South Africa is Women's Month, and Tuesday we celebrated Women's Day. And the women in this program, these are not all of them, there are about 20 scientists and engineer women with their male partners, counterparts, working on this very fundamental project. But what I want to demonstrate here is we have started greenfields from the basic design of a plasmid, the cloning of it, the production of the DNA, the purification of the RNA, the production of a drug substance, the formulation of a drug product, to full finish, now moving into preclinical and clinical development. Just because many organizations, people in the world doubt the ability of low and middle income countries in Africa to do this, doesn't mean that we shouldn't take it on. We did. And now let me report, and it's feedback from the team this morning, we are in preclinical development, and the results of this vaccine candidate is equal, if not superior, to the best mRNA vaccines that we know. So we are on track to go into clinical trials early next year. We're building a platform, and COVID-19 will validate the platform for mRNA production capacity in low and middle income countries. Next slide, please. Detailed project plan, just because it seemed impossible at the starting line is no reason not to dive in. Important learning. When we started the project, we had the anticipation of receiving a turnkey technology transfer package with everything in place. We had to greenfield, start from nothing. If you look at this project plan, and there's not one page, there are more than 200 line items of specific activities in a multidisciplinary, complex project to ensure that a vaccine is designed, developed, scaled, produce a vaccine that's safe, affordable, and effective, and a technology that is accessible to the partners in this network. No reason not to start just because of the complexity. Next slide, please. Very important. The bilateral technology transfers are the managed norm. This is what the world are used to. Most cases of technology transfer happens between two parties under strict conditions, rights and privileges, voluntary but restricted. This program has taken the bold step of not only developing a vaccine, not only developing the platform, but while developing it, to transfer the technology, the know-how, the skills in a multilateral technology transfer model. And again, credit to the designers of this project, the people from WHO, the Martin Frieders and other partners that has put this very, very challenging model of multilateral technology transfer together. This will be proven to be a model for fast track, provided that there is a willingness to share the knowledge and the intellectual property and know-how that is developed within this network. Important learning, an important model to be tested for diagnostics, for therapeutics, and for other essential health technologies in capacitating low and middle income countries. Next slide, please. And then, of course, this has become the biggest network of technology transfer in the world. And you'll see Indonesia here. AJ and his team already visited South Africa. We were so proud to host BioPharma at African for the first introductory training. Again, here the learning. The complexities of global distribution and supply chain diversification is not a reason to simplify the reach that we may have. This is a phenomenal map of 16 countries straddling 4 continents, building together on platforms that will not only be COVID-19 vaccines, but beyond that. There is a pipeline of vaccines currently being considered and reviewed. Vaccines that is essential for the burden of disease in these countries and continents and regions that could be produced and will be produced on these platforms and in these facilities to supply to the regions, the global south, their own critical and essential vaccines. Next slide, please. Intellectual property in this spider web of complexity of the mRNA IP landscape. You can imagine intellectual property, mRNA is such a promising, such a valuable platform. It has now demonstrated its superior value in vaccine development. This will be a very, very complex intellectual property landscape. The fact that it's complex, the fact that we have to maneuver through freedom to operate and access technology was not a reason to abandon an mRNA platform for capacitating low and middle income countries. We have learned now to maneuver. We've learned to innovate around. We've learned to set up partnerships that will allow us to have freedom to operate. We are tracking and monitoring, and we will also have the ability to innovate more than we would have been if this wasn't this very complex network to maneuver through. Next slide, please. The line of intellectual property and freedom to operate. Out of the box strategic alliances. We have set up alliances. We could not do the alliance with the big 5 and big pharma, but we're setting up alliances with biotech companies, smaller biotech companies that has proprietary technology that they are prepared to share and make available for low and middle income countries. So we want to improve the current mRNA vaccine platforms or COVID-19 vaccines. We want to have better thermostability so that these can be absorbed in the cold chains and logistics systems that is very prevalent and very well operated in low and middle income countries. We want to reduce the cost of goods. We want to ensure that the vaccines are affordable. And of course, we want to capacitate in the most cost-effective manner. The other partnership, a partnership with the NIH in the US. This is the biggest health research entity. It is the giant of health research globally. A partnership where they will make available years and years of knowledge and technology and know-how and immunogenicity targets to help low and middle income countries to build mRNA pipelines of vaccines. Important learning was out of the box. It is not it wasn't a technology transfer. It now becomes beyond developing a first generation technology to actually looking at developing second and third generation technologies. Next slide, please. Just back to South Africa, Africa, my continent. Before COVID-19, there were very few technology transfer projects on this continent, and it was mostly in South Africa. And of course, Egypt. And these tech transfer projects were purely full finish. Post-COVID, there's a whole world unfolding with tech transfer in many, many countries, many organizations with partners across the globe in the high-income countries, and of course in the creation of this platform. Let's keep the momentum, Africa. The Partners for African Vaccine Manufacturing is setting a strategy that could be a trailblazer for a continent. We must keep up the momentum. Next slide, please. I wanted to share some thoughts. You earlier said, and other speakers re-emphasized the tragedy and the difficulties that the first 2 years, and actually the history of the COVID-19 pandemic brought to the world, and how it highlighted the absolute need for equity. And I want to look at the last bullet here, the fourth bullet. There were very major international initiatives launched to ensure equitable access. There was COVAX, the CETA, ACT8, TRIPS waiver, the Partners for African Manufacturing, and the mRNA Technology Transfer Hub. I want to pause for a moment on two of those initiatives and ask for a careful, not investigation, a review so that we capture the learning. Next slide, please. Initiative, access to vaccines and access to technology. The COVAX initiative was well designed. It was well intended. It was created by the major global health alliances to enable vaccine equity. It was funded from high-income countries. Even South Africa contributed to this fund. Although South Africa is not a COVAX supported country, we contributed in the hope that we would get vaccines. We did not. This was a model to pool vaccines for distribution where needed. And COVAX achieved a lot. COVAX achieved more than 1 billion dose distributions. But what are the learnings? Underlying in COVAX was bilateral agreements. It was vaccine diplomacy that was created, a new word in our dictionaries. The second case study that I believe needs to be carefully reviewed, and we should capture the learnings, not to repeat, is CTAP. Brilliant initiative, COVID Technology Access Pool, a model designed for success. How do we fast-track access to know-how, data, capabilities, to ensure that we fast-track the production or the supply of essential COVID health tools? More than 40 countries endorse this at a voluntary level. And 12 months later, CTAP had 0 contributions. I've made this the topic of this slide. Alignment is not enough. We need enrollment to bring change and success. It reminds me often about organizations. You know, we as leaders of organizations sometimes have to restructure. And we're going into change management processes, and we're going into changing the strategies of organizations. And the one thing that I've learned as a leader of an organization, do not think if your leadership and your people are aligned that you will embed change. You need enrollment. You need active commitment and enrollment. And in my view, both of these very important initiatives, global initiatives that was created to fast track access, was alignment, but insufficient enrollment. Next slide. This is a slide from WHO working at the moment and also published by the team here, working on what they called adaptive, positive global landscape for not only vaccines, but essential health tools. What is important about this is the inclusiveness, the vertical integratedness of this, and the fact that it will require partnerships and collaboration at a global level to ensure that we create a sustainable pandemic preparedness model. Next slide, please. I have a few teasers that I want to leave with you, and they are challenging some of the paradigms. And these conversations are now happening at various levels. And I think we should continue to challenge some of the paradigms. The first one that I want to challenge is the mass reliance model equals access. Recently, the Berlin discussions and convention is that Big Pharma has the capacity and the ability to create mass supply. That creates mass reliance. We've seen now with COVID, with HIV, with influenza, that did not result in access. Maybe we need to carefully and very seriously look at different models. Secondly, the general view that self-reliance, the self-reliant desire of low and middle income countries is unsustainable, costly and risky. Why? Why? Because we think that scale has to be big. The paradigm is that for sustainable vaccine manufacturing, these facilities need to be huge in volume, size, and resources. We believe that in the network we're creating, the numbers we are working on, and the models we are working on, that small is scale. Multiple facilities, 20 to 50 million doses, can be cost effectively operated and can be kept in pandemic preparedness mode because the operating cost can be carried, and these facilities can produce smaller scale vaccines, pediatric vaccines, other vaccines of neglected diseases in low middle income countries that will bring sustainability. We need to unpack a different unit of economics. Next, Africa is incapable of vaccine innovation. I think we've demonstrated that that's a paradigm that we can really put to rest now. And then the issue about global pandemic preparedness can only be sustained in a centralized model. There are a number of initiatives in a number of countries, country level, regional level, global level, looking at pandemic preparedness. There are organizations such as CEPI, the WHO, and others that are driving models and looking at building the networks for pandemic preparedness. It cannot be a centralized model. It has to be decentralized to include the global south in sustainable, back to the economies of scale discussion, entities that can be kept supplying vaccines, but also in pandemic preparedness to be able to switch within 90 days. Next slide. In my thank you, I want to leave with you just a quote. A thought of what really needs worth changing. Ask me how. I think this is what you as civil society, as the conscience of all of us are starting to do and working with us. The world is bipolar, and the polarity is not really driven by geology or geography, not by positive or negative. We're not judging, not right and wrong, not good or bad, but by have and have not, and what we want and what others want to keep. Let's keep this dialogue going, because we will not create global access and equity if we allow the bipolar world to continue. Thank you very much for giving me the opportunity.
Thank you so much, Professor. And once again, thank you, everyone. We can give a round of applause again to all of the speakers that have already give us the insightful informations. But before we conclude this opening sessions, the organizer will have the photo sessions to all participants here. But everyone here don't need to move. Just stay wherever you are, because the camera will capture from this side, right? And everyone just need to smile and maybe open the mask if you guys don't mind. From which side of the camera will be? That side? Okay. 1. From that. It's okay. If you guys don't mind, to all participants can come to the stage, just in front of the stage. Don't have to on stage. Please, everyone, come to the in front of the stage. Yeah, that's what. That's better. Semangat. To all participants also can turn on the camera features. We will have that. We will take a picture, a screenshot of the Zoom platform. Okay. Is it good? Okay.
1, 2, 3. Once again. 1, 2, 3. Okay.
All the online participants, please put it on the back. Yeah, put it on the back drop. So one picture with offline and online can get into one. Thank you for everyone's patience to wait. Do we have a problem? Do we have problems? While waiting, maybe just took several photos. Okay. Okay, the online is ready.
One, 2, 3. Once again. 1, 2, 3.
Thank you so much to all participants. I think that is all for the end of the opening sessions. And thank you very much once again for those of you who keep following C20 Vaccine Access and Global Health meeting up to this point. We will continue to our next agenda, which is first plenary sessions at 7 p.m. Jakarta time. For those of you joining us online for online participant, please access the same Zoom link for the next plenary sessions. And for those of you who are joining here directly, we will conduct the plenary sessions in the same room, in this room. So don't forget to all participant here that we will provide dinner for just right beside of this room. So don't miss the dinner. Thank you so much, and see you again for the first plenary sessions. Thank you.
Recording stopped.
Check, check. For a glance of information, the dinner will be ready at 6 in the restaurant. Thank you.